My name is Antonia Apolinario Wilcoxon. I serve as the president of the Minnesota Public Health Association. I'm very grateful to see the room and all of you here enjoy your breakfast, and I'm very grateful that the women who put this forum together have worked so hard. Thank you, Dr. Angie Carson, Lindsay Fabian, Leah Berg, and Kathleen Norlin, Kathy Norlin. Also, thank you to the Friends of the Forum. They have made donations dollars as Friends of the Forum sponsorship, and they are listed in your flyer in front of you on the table. I would like to call your attention to today's theme, changing views about immunizations, about early socialization and development, about the impact of video gaming and social media on the development of sound mental health. These questions and more will be explored in this forum. The forum this morning is going to be moderated by Dave Golden, and I'm very pleased to introduce him, and he will be coming up in a minute. Dave is a retired employee of the University of Minnesota, where he spent 38 years. He is yeah, I think so. I guess a couple more things to say. You will make your own introduction. I'm sorry, I can't find the bio. I found the bio, and if you have in your table, you can read it by the QR code. Me and technology. The ancestor land acknowledgement is a statement that we read at the beginning of each one of our meetings, committee meetings with the Minnesota Public Health Association. And I'm not going to belabor here, but I'd like to tell you that our equity committee, who worked extensively on this statement, is working yet on adding additional language because of feedback we have received. We want to make sure that we acknowledge in words, but we also provide ideas for actions that we can take as we read the statement, that there are opportunities for us to move to action. I'd like to call your attention that you save the date. The next policy forum is scheduled for March 22nd, mid-years, and then the May 17th, older generations. So, and then we are preparing for our annual conference, and that is scheduled for April 25th through the 26th, and at St. Kitts. And you also, could you please pay attention to the proposals? The deadline is January 26th, and we would like to receive lots of proposals, so we have very nice and informative conference. I'd like to now ask Dave Golden to come, and I'm passing on the baton to him so he can domestically lead us this morning. Thank you.
But 0 degrees out when I pulled in, so people came. That's so exciting. You know, so it's really nice. Come in from the cold. I know, in our sort of fake winter so far. So it's good to see everyone. And I do just love the forums in general of MPHA. I think this venue is great. And I like the interactive side of it. Like we'll get a chance to sit at tables and come up with questions a little bit and all that too. I think it's a really good thing to do. And the theme this year, I mean, the fabulous four that planned this plan these is just amazing, as far as the different clever themes that come out that you can work with every season. And MythBusters is no different. I love the theme. It's really fun because so often, a lot of us in our work in public health, we spend a lot of our time trying to bust myths. Usually that's something that's holding people back from doing something that we want to stop doing something that they're doing. A lot of times has to do with myths. And I know that we're probably carrying some myths of our own that we'll find out somewhere in the future that, we weren't, okay. We find out of our own that we'll get busted eventually. That we live with now. I know in my time at the university, I had some basically some favorite myths that we have learned along the way. I worked at MYTHBUSTERS, there, and so we looked at our university student population over time. How does there were loads of myths. And I wasn't going to go do this, but Linda Hampton is back here, and Linda was my supervisor for a short time at Point Health. And actually, we saw together that was really important when it came to myth busting. We actually created the first survey, comprehensive survey for college students in the country. It was sitting in a room with Linda going, hey, we should do that. Where we learned all kinds of things, particularly things that we were totally wrong about our population, which was absolutely incredible. And so, but we learned all kinds of things. Got our panelists here. So let's start with getting a few words from some of our panelists here. So with me, our first speaker here. Let's go with Sue Abderholden. I don't think there's a person around that has not seen or heard of Sue and Nami. It actually finished from 2001 with Nami, and it's just incredible work, tireless work around advocacy when it comes to mental health in our population, which I just think has been fantastic. But so I'd like to welcome Sue. Number one, so glad that you're here as a panelist, and if you could say.
Sure. So for those of you who don't know much about NAMI, we are a grassroots organization dedicated to improving the lives of children and adults with mental illnesses and their families by providing education, support, and advocacy. Nearly 100% of our board staff volunteers either live with mental illness or have a family member, so we really are the people that we're representing. The education part for us is really important because families don't know how to deal with someone who has delusional thoughts, right? Just hearing voices. You don't get that information in your high school class, right? So we provide education to families so they can understand how to help their child or adult family member, and have different classes for both adults and for families and children. I think that's important in this different community and health system and things like that. We also do public education. One of the programs, and the best way actually to change public attitudes is when people share with them. Then you see someone that looks like you, and you're like, oh, okay, this can happen to anyone. I don't need to be afraid to talk about it. We actually are afraid of using the word stigma and actually calling it what it is, which is discrimination. And well, and stigma is just like such a big word, right? Discrimination. So people aren't sharing that they look mental illness because they're afraid of discrimination at school and at this job and promotion or this housing. And we have a new program coming out called our Journeys, which is for people from specific cultural communities during story education. We also do most of the education classes on suicide rates rising. We want to make sure that we even have a really good practice for families so that we can get that first year on the whole process and all of that. And Dr. Slippers, there's nothing like going with someone who's been there, done that, to make you feel good. And because they're run by either a person with an illness or a family member, when you see that person actually doing well and giving back to the community, it gives you hope that you also will get there. And so I think being peer led is just a really important part. We actually branched into employer education. So pre-COVID, we focused on mental illness in the workplace. COVID hit, and then we started doing, minding your mental health during COVID, and we've added classes on belonging and trauma as well to really help employers. Teens and middle school students need a lot of education as well, and we have 3 different programs. One is a national program called Hidden Silence, reached 9,000 kids last year, and it involves actually a young adult who's doing well with their mental illness who also presents. So again, those young people know, like, oh, okay, I can be better too. And we also help them to break about themselves, which I think is also important. We do individual advocacy as well, because, well, navigating the mental health system isn't always easy. So we take probably about 3,000 calls a year, and then we do a lot of legislative advocacy. So we want to, we need to continue to build a mental health system. So that's the first myth I'll throw out there. I know we're going to get into children's mental health later, but the mental health system is not broken. It was never broken. The state institutions were not a mental health system. And I think actually for families and others, right, it is much more hopeful to say, yeah, there was never a system. It's not broken. We're building it. We're finding out what works. We're trying to expand, things that work. Working with the legislature isn't always easy, and there's so many demands in health and human services finance committee. But what we've seen, if you really look at the history, there have been important changes almost every single year. And so I always have hope that we will eventually get there, but it's going to be kind of longer time. So I guess I'll stop there. Thanks.
Oh, our next speaker is Maree Hampton, who is a former colleague who we used to work together at Health at Minnesota, but that was quite a while ago, and we've gone through all kinds of things, including founding an organization called Live More Screen Less that focused on digital media and the impact on our youth in particular, and has developed an area of expertise from some today. I know that when we did our college health survey, and surveyed students at the University of Minnesota, just the year before, about a year and a half ago, for the results, and our population got over 50% of our population had been diagnosed with ADHD. 2% were on medication for a mental health condition. When I asked our therapist about what do you think the biggest reason is for this, virtually all of them would say this: our interaction for this baby. Whether it's true or not, I don't know, but this was their take on it. But Maree, we want to look at a little experience.
Thank you, Dave. Really great to be here with you all this morning. I always learn so much from Sue every time I speak. I kind of feel like I'm on the MC, really. And look forward to hearing from our other panelists here. So yes, I co-founded Live More Screen Less about 4.5 years ago with former educator Catherine Myers. And when KK and I set about to start this organization, it was to really better understand what happened, knowing that the trends in depression, anxiety, suicide ideation are going up in our state, and that was mirrored nationally. And of course, we know there are many contributing factors to those rises. But we were really convinced that yes, digital media was playing a role. There's some early work by professor at San Diego State University, Jean Twenge, wrote a book and coined the term iGen, And it was really her pioneering research that showed the onset of extensive pervasive use of smartphones was around 2012. And there's all kinds of correlations that exist that show that from 2012, prior to the pandemic, we know the pandemic really brought this issue front forward, but the rising trends in anxiety, depression, are related with the onset of pervasive use of smartphones and technology. So much research. We took a deep dive. We started an organization in end of June 2021, received a $1 million grant from the state legislature to build a resource library. So really encourage you all to take a look at that at livemorescreenless.org. There's a resource library with a ton of research. But I think what I feel most proud about in the work that we did with Live More was listening to young people. So just as Dave talked about creating the college health survey to really understand and bust those myths around college students, we took a similar approach and spent a lot of time talking to young people, visiting them in classrooms, holding focus groups more formally, conducting surveys to really get a sense of what is your experience like. The first generation has had to, and people tell us, we didn't ask for this. And yet it's been foisted upon them. It's been foisted upon all of us. So it is really to approach this issue with empathy and to understand what young people are experiencing. So very proud of that work. I just left Live More Screenless because I want to engage and embark on work directly with mental health professionals and public health professionals. So I'm eager to connect with those of you in the room that are interested. I'm also part of a national network, and I'm eager to focus more on advocacy on the federal level, trying to get this Kids Online Safety Act passed. We know as public health individuals that policy is really important, legislation is really important. The burden on parents is too great for this issue. It's too much on all of us, it's too much on the kids. We have to have some federal regulation that happens, so I'm looking forward to that.
Thanks, very good to have you here. Denise is here from MPH, and as a coordinator for school health. So think of what that is like. There's two of you. The whole page. That's great. Yeah. We have something to do today. So thanks for being here with us today. And again, a great area of myths. And also, you know, when you think about school health, so often the school health person, so much is expected of that person. What might have been that's first function in school health, but so good to have you.
Thank you for the invite. It's very nice to be here. As I said, I'm Denise Herrmann. I'm a registered nurse and a nurse practitioner, and I sit in maternal child, which is the child family health division at the Department of Health. I am a school health consultant, colleague health, and colleague expanded to So, you know, Minnesota is a state of local control when it comes to school districts, right? So, you know, we have individual kingdom, kings, queens, or 68 of them, which is 42%, have no nursing services as well. So we have kind of an antiquated, the statute was back in 1987, 88 when it came about. That is not hitting the mark that I think it was intended to hit, right? Our kids that have the most need aren't getting, and we know that we would all love our kids to go to primary care and get their immunizations on time, and they always have their asthma inhaler, and their diabetes is 100% under control, but that isn't the reality that we live in. And, you know, in terms of mental health,
We did a survey last year in 2022, and school nurses say the number one thing that there's 30% of their week, up to 50% of their week is doing children's mental health. And for school nurses, the early part is that early somatic complaint. I have a stomachache. I have a headache. I don't feel good today. And once you get past, did you eat and did you poop, right? Then it's probably mental health. So they are working very hard in that first level. So Heather and I support school nurses. We support school districts that don't have nurses by laying out best practices, recommendations. When the naloxone legislation hit, we developed a toolkit to come out so that schools could not just think about putting the drug in a box, but, you know, are you going to have an after action event? Where are you going to train? How about some parent resources on why you're doing this? Those kinds of things. So thinking broader about, you know, this is just one little piece of what we're talking about and why we want naloxone in school. So we work hard to provide best practice recommendations, resources for people, to the nurses and administrators, help them problem solve and consult throughout the state. Work a ton, especially in greater Minnesota with local public health, who often support some of these smaller districts where there's only, 200 kids. They have local public health, so obviously.
Cool. Again, another myth that's probably out there. Well, let's start off with a question. And this one is, we'll start getting any questions, and then also at your tables, you see those blue cards if you haven't been here before to come up with some of your own as we go along here as well. But let's start with this one in terms of how do you think social media has impacted your area of expertise, either positively and negatively, or both? Anyone want to go first?
So I love Slack. How many of you are users of Slack? Okay, so it's I mentioned a national work group that I'm on that's based out of an organization called Fair Play out of Boston. There's 40 plus members of this work group. It's online harms prevention, and we meet monthly. And Slack enables us to communicate and upload documents, to share news articles, to share research, and you can go back in time and just scroll up in case you miss a meeting. You can watch a recording. It's a comprehensive tool that we are using to communicate with one another between the time that we don't see one another and to follow up and be accountable. So huge fan of Slack because it keeps me informed and it keeps me accountable.
Well, I mean, you kind of talked about it already, but yeah, I think social media has both hurt and helped some kids. And we know so much about the data and research. And some kids are on it for so much. The one group that has sometimes been helped by it are LGBTQ teens. Because sometimes in their own communities, there's no one who's really understanding. And if we look at during COVID in particular, the suicidal ideation among those particular teens went way up. And so they might not have gotten the support at home that they might have gotten in school from teachers or other students. And so for some of those teens, connecting on social media has been helpful because they're not feeling alone. They're seeing their stories on there as well. But I think otherwise, generally what we've seen is that it's really difficult. What we've seen, particularly at NAMI, is, when I was growing up and if you got bullied, you went home and closed the door. That was the end of it. You got to feel better before morning, right? But that's not the case anymore because you're bullied 24/7. And so you never have a respite from that to really even practice your resiliency, right? And to kind of move on. And so we just see that as the bullying part as a really huge problem among our youth.
Well, since you all addressed the kid aspect, I'll go from the parent aspect of social media. And it really heightened during the pandemic and has continued now for all of healthcare. And of course, for healthcare in schools, whether it's parents or administrators, is the fact of getting reliable information about health. And having to have each, if there is a nursing school, you know, bust that myth about what this means, what the symptoms is, what that disease is, those kinds of things. Having decisions constantly challenged, like, you know, a recent one that I heard about was that their child was not vaccinated against measles, therefore there was an exposure, so they had to stay out of school for 21 days. And the parent was angry that we didn't want measles in the school, right? And so that kind of thing, that in terms of all of those myths out there, that misinformation that channels through and that they stay on that same channel, having to deal with it in their offices. And then again, like I say, even with school staff is a constant bombardment that it was much slower pre-pandemic and it was much more intermittent. And it was kind of just, oh, maybe that one there, and it's much more pervasive now in terms of dealing with that.
Thank you. Let's just do another one for Denise here. This has to do with the parents and the decision not to get children vaccinated. What do you think is the
It's the ghost.
what do you think is the best strategy to try and vaccinate mom? But what do you think is our best strategy to try and do so?
Wow, if I could answer that, I would be famous and I could retire today, right? Because there are very many experts than myself that have been trying to address that question related around immunizations. And, you know, if we go back and read through history, right, we've always had where this has been related to that. And I think, you know, for schools and in the schools, if we can hit the middle spot, because there aren't a ton of people over here in the absolutely, I will never do this spot. There are the people over here that have the challenges related to access, misinformation, lack of insurance, can't get off my job, you know, all of those things, those social determinants, right, that we all know, that keep us from doing it and not seeing it as a priority. And, you know, this is that first generation of, and I remember I had measles that my mom remembers when St. Paul was shut down for polio, but my son, that generation had no experience with any of that kind of thing. And the worst thing is in COVID, and of course that vaccine just happened just like flu and dissuaded a lot of people. So I don't know that there's a magic bullet, but I think that for in schools, we're working really hard with that middle that are maybe delayed or can't quite get to the social determinants, that kind of thing. And to this end over here that just is absolutely no, is, you know, making sure they have accurate information, where to go to get accurate information. But we want to get that sweet spot so we can get back up into those 90s, because we're pretty protected if we can get way into those high 90s related to that. So we're really working on that middle and addressing what I think are social determinants, education, that kind of thing.
Great, thank you. And Sue, you've been at this a while. And so, you know, in your time working in this field, you know, what do you see is sort of the greatest accomplishment that's happened so far for you? Look at, you know, mental health in our population.
Well, we don't have that much time, but I would say a couple of things when we look at children's mental health. One is mental health parity, which is not totally enforced yet, but you know, there's 3 pillars of parity. You can't have, you know, different co-payments out of pocket costs, can't have arbitrary treatment limits. and you have to look at non-quantitative limits. And that's the area that we don't do well. Because it's really trying to compare things, right? So if your health plan is going to pay for a nursing home for rehab for a new need, should it pay for rehab for someone with schizophrenia leaving the hospital, right? And we've created in Minnesota, they're called psychiatric residential treatment facilities. So it's really a step up from the current residential and a step down from the hospital. And our health insurance companies in Minnesota would not pay for it. And when we met with them, we're like, well, the statute says that you have to pay for hospital and you have to pay for residential. So pick one. A PRTF is one of those. And they said no, that it was a Medicaid only benefit. But last session we mandated it, so now they have to do it. But it took frankly that long. The other program that I am really proud of in Minnesota, and we do, I think, a better job than other states, is their schooling to mental health program. You know, what we heard from families in the early 2000s is, you know, if your kid needs therapy, for example, it's often 24 weeks. Not many families can take off of work, right, once a week for 24 weeks. And it takes a long time. You know, I mean, my daughter was in therapy and it was like, I'd go from my office to her school. So that was 20 minutes. And then I'd take her to the therapist, which is another 20 minutes. Then I have to drive her back to school and drive back. I worked for NAMI and I was the boss, so I could do it. But, you know, other people can't take off that kind of time. And what we saw were kids were not actually completing their treatment plans. And so then we're really not getting them through all the different, you know, kind of sessions that they really needed. And so what schooling does, which I really appreciate, is that the money actually goes to a community mental health provider who then co-locates in the school. So we get rid of, you know, the barriers that families face in terms of transportation, payment, who do I go to, all of those things. And for the therapists in the school, they see the child in their own review, which is also a good thing. And they can work with teachers. So the next time they have a first grader who has school refusal, right, they kind of understand, oh, this is anxiety. Oh, this is what I need to do. And because it's a community mental health provider, they can build public and private insurance, you know, tied to special education. And then grant money pays for kids who are uninsured or underinsured. And what we saw is actually a lot of that money in suburban schools, because suburban schools tend to have families with high deductibles and so who can't really pay for the therapy. We're in about 70% of school buildings right now, which is pretty good. The other nice thing is there's actually a firewall between the education records and the healthcare records, which was also really important to families. So I think it's been a great boon, but I can tell you that usually by November, early December, there's waiting lists. So it's great, but we need to, you know, continue to expand it, obviously. Early childhood mental health, you know, is a newer area that I think we're making some progress in, which is great because, you know, when you hear about little kids who are 3 or 4 years old being taken out of daycare, it's like, you need to be doing something, right? We need to be doing something. The last thing I'll mention, kind of more related to public health, is that, I have my degree in public health administration. No one talked about mental health in the school of public health when I was there. No one. And I think it's only been more recently that we've seen a greater about it. But we need to make sure that we're looking at all 3 levels, you know, tertiary prevention along with primary prevention, especially for things, very serious mental illnesses like schizophrenia. For a lot of schizophrenia, you're not going to prevent it, but we can prevent it from becoming disabling. And so we need to make sure that those kinds of programs, which we have a couple in Minnesota, are really intervening early and with intensity, not waiting until someone gets so sick that then we're going. So I'll stop there, but a lot has happened, a lot of good things.
Oh, it's such a great presentation at the MPHA conference. The progress. Just that. That sounds so hopeful in so many ways. You know, I mean,
I'm always hopeful.
Yeah, it really does. It's really inspiring. So.
Well, I had a wonderful mentor back in the 80s, and what she said to me is, when you look ahead for all the work that needs to be done, you need to look behind you to see how far you
Yeah. Yeah. You need to get to work. I'm watching time here. Of course, I'm watching. But you all need to get to work. We've got the blue cards on your table, and we've got, you know, quite a panel here. So if you could take a few minutes and talk amongst yourselves, a few questions.
Dave, can I just interrupt?
Yes.
Okay.
Of course.
So when I answered your question earlier on, I was thinking professionally the benefits of social media, and I just want to share just a few things that I prepared. Social media, like, okay, so we know that youth mental health is a huge concern. That's probably why many of you are here. Dr. Vivek Murthy, our Surgeon General, our nation's doctor, has really brought this issue of technology and how it's impacting youth mental health to the forefront. So he released 3 advisories, one in December 2021 and 2 this past year, really bringing this issue to the forefront to call attention to the ways that social media is impacting young people. Now, we know there are tons of benefits, and young people are quick to share what those benefits are for communication, for entertainment, for creativity, for social activism. Like, there's no question that there's a lot of benefits. But we also know that there's a lot of harmful effects, and Sue spoke to cyberbullying, which is significant and affecting, I know one survey, 47% of young people said they have been impacted by cyberbullying. So whether or not they're seeing others being bullied online or they're experiencing that themselves, it's a significant stress. So we know that exposure to content, harmful content, can impact young people's mental health. There's no regulation with the internet. Like, our children are exposed to things that they should not be exposed to. And we've had young people tell us, high school students who said, yeah, when I was 7 or 8, I saw something that I should never have seen. So average age for exposure to pornography is 10. And so we have a whole lot of work to do, and we know that this is stressful for young people. It's stressful for children. And one issue I just wanted to bring up is that when we speak to parents and when we engage with communities of parents, number one tip is to get the phones and technology out of the bedroom. We have to protect our children's sleep. As a means for primary prevention, we need to pull back and provide spaces in homes where technology is not accessible, so that children and young people have time to kind of decompress and get away from it. It's stressful for them. They tell us they feel compelled to be online a lot, because what if that friend of theirs is in distress and they reach out to them and they don't respond quickly in a text. So there's just the constant stress that our young people are experiencing impacts their mental health. So anyway, I just wanted to say a few things about what our young people are faced with navigating this 24/7 access, and that we all need to be doing better, especially at our federal level, with some regulation to protect our young people. We absolutely need to take action here. And I have all kinds of ways you can follow up with me. I'll share with ways that you can get activated in this.
Great. Another good. Thank you.
You're right.
Okay, take a little time with the cards and we'll collect them and yep. Our fabulous 14 will be picking them up as we go around.
My mental was better.
This could be a record. I've done a few of these. I don't remember ever getting this many questions from the group. So thank you. Well done. Apparently you weren't clear. It didn't, yes. Let's see. Okay, there's so many good ones here. Where to start?
You can do it.
I know I can.
I'm a very engaged and vocal audience member. I like to encourage people. You got it, Tate.
All right. Well, let's start with a simple question. I mean, how can parents and public health people advocate for more school nurses? We'll start with the easy one. Solve that for us.
think, if you think about education as one circle and health as a second circle, right? School nursing is that sweet spot right in the middle, right? We can do healthcare in schools. It can be in the education system where kids are spending 6 hours a day, you know, how many 180 plus days a year. And it can talk education speak and it can talk healthcare speak. The hard thing is when you're in the middle, you're also marginalized in those systems. So healthcare thinks that's education. Education says that's healthcare. And so nobody wants that. And so that is that myth buster, because we gotta say, oh my God, we got this sweet spot, we gotta go after it. And I think the other thing I had a conversation, we expect schools to do a lot. When we had the pandemic, we realized that schools won't teach them to read and write. Oh, by the way, can you do before and after school care? Oh, they also need to be fed. Oh, we need to make sure they can still tap into their mental health, that their physical health, you know, the demands for schools, and then, but then there's funding issues. So the two big funding issues is if we want to hit that sweet spot, we need to look at both systems and say, one of the things with healthcare that our state doesn't do, it hasn't opened up EPSDT funding in schools like other states have for simple things like vision and hearing screening. There is no way to capture revenue that when you do that kind of public health work, when you do your annual immunization work, when you're walking, talking with parents, there's no way to capture that through our state Medicaid system. So that is a big thing that we need to write in terms of accessing the federal dollars, and have to be state dollars accessing those federal dollars. And then statewide is having some dedicated funding, because again, their main mission is reading, writing, arithmetic, and they're, while we all know healthy kids can't learn, a lot of their constituents are more concerned about the reading and writing because it's not my kid that needs a health issue. That's your kid that needs a health issue. So to come in with some statewide dedicated funding that would do that in terms of providing for the care and looking at what they need. Those are two big policy issues. And then looking at the statute and saying, this statute is perpetuating a structuralism and it's not really caring for the kids that we need. So, and nationally, back to nationally, there is a legislation to look at, again, if we're talking about equity and Title I schools, which are usually your schools with a higher free large, all the other things that come in, doing some funding from the feds down to the state. But, you know, Mississippi put a school nurse in every school. Mississippi has some of the worst public health outcomes, right? They put a school nurse in every school. I keep thinking Mississippi did it.
And we'll go to a more topical, question, because we're facing this all the time. This has to do with who gets to own the truth about these different issues. So, for example, for this question, how do we help people find and or accept valid facts? No facts about things, but a lot of just accept those. Although in so far as that are myth, but sometimes they're just flat out lies, which is something entirely different. So yeah, if you have any thoughts on that?
I have just one thought. Of course, there's probably lots of answers and solutions around that, but it's really imperative that we have digital media literacy that would be in schools, I believe, or even our youngest learners. If you look at some of the stats, there's a high percentage, I think 75% of teens get their news from social media, from Snapchat, from Instagram. And I think there's been some, yeah. And I think some surveys of middle school students they're not able to really distinguish. If they see something that's online, they believe it right away. And so I just, from a primary prevention perspective, I think we need to start early, and we need to start with parents of young children as well. So that's one little issue to the big question.
Yeah.
No idea. I mean, people still think that someone wants to. So despite everything that's been out there. So I think it's starting young and hoping that people kind of understand, the difference between what gets posted on social media and true investigation.
Fun libraries. Fun libraries. The librarians, I have to say it.
Yeah, no, I think yes, I agree. Librarians, play a very important role in this, but we also have to get people to you, to learn.
Yeah, this one has always been this has been a huge challenge, I think, that we're facing now. It's just trying to agree on what the truth is out there and what to believe. They were 1/4 and 20 years ago. Small papers have been folding, right, closing, right, left. We lose small papers more every single day. And the companies like Google, et cetera, have figured out ways to make sure that the stuff I see on my feed is the stuff I kind of agree with, that I can relate to. And so it makes the truth very, very difficult to be accurate. When I did a bit of a look back in history of immunizations, not that long ago, like you say, there's always been folks that are strongly anti-vax. However, when we look at polio, and we have big resistance to polio vaccine, the government recruited, Hollywood celebs like Elvis, spokesperson for polio vaccine, et cetera. But, people did sway, not just because of that, but they believed in science. Now we've got a problem with people who believe in science. It's a big problem.
Some celebrities that don't believe in science. So if you're an influencer and you don't believe in science, we're in real trouble.
Real trouble. There's no doubt about it. All right. Let's see. How can the public health community better support and fight for true primary prevention in digital media? What we see is where public health efforts there.
Well, we're a fan when we created our sort of curriculum and resources at Live More Screen Less. We're a fan of the social ecological model. So the public health community, of course, you can have influence on various levels, at the individual level, just becoming aware yourself around the research and around practical strategies to practice digital well-being, and then sharing it with your community, activating your school to be mindful of how much homework is screen-based. As parents, I think there's a lot of power that parents have in public health, school health, not to add something more to the plate of school nurses or school health promotion, but there's a role for lots of individuals to play in communication in school settings. And then, of course, at the policy level, it'll be interesting over the next couple of years to see what happens. Again, I mentioned Dr. Vivek Murthy's 3 public health advisories. I think because of that, those attorney generals that came together that are suing Meta, Minnesota is part of a suit with 40 other states. I think we'll start seeing some more legislation. So it is, as a public, to be aware of those public health advisories, read them. There's all kinds of practical solutions and guidelines for wherever you sit in your public health community, as a parent, as a community member, as a public health professional, as a policy advisor, whatever role that you have, to bring it upon yourself to read those Surgeon General advisories and look for solutions and bring it into your conversations wherever you work. We could do better, and I think we're going to start seeing more and more schools. For one approach is to eliminate or ban cell phones during the school day, or make it limited, because it's interfering with our for students. So that's just an example of a policy, but I think we'll see more and more as more pressure is put on these big tech companies.
The other thing I think is that there's real power, especially in the local level. I try to go out throughout the state, and I was in Fergus Falls yesterday with school nurses, and I'm not going to remember which county local public health was there, but their role to also myth bust at the local level. So they had a dispensary that was now advocating and saying the healthful benefits of cannabis for ADHD. And, you know, they were able to, you know, work and to stop that kind of misadvertising at the local level. And it takes a lot of courage and takes a lot of support on the local level, whether it's our county administrators, et cetera, right? To myth bust at the local level. So I think that that is the other thing that we have, whether that's myth busting in a school or in local public health, is taking the courage and being brave to bust those myths as soon as we see them come out in our local communities.
I just have one more thing. Of course. We talked about social norms earlier, and I would love to see a public health communication campaign nationally that focuses on the persuasive design, to increase the understanding around algorithms. I don't know what the message would be, but I'd love to borrow from what we learned from big tobacco, because right now we're in a big tobacco moment with digital media.
It's a great analogy. Agreed. So, yeah, this is a mental health question. Way back, long time ago, at a time called 1984, I got a job with epidemiology. Our job was to take the whole city and reduce risk for cardiovascular. Great place to play. But I didn't. It was by accident that I ended up in the job. I had no idea. Anyway, but we had a pretty good playbook to work from. We knew some stuff. We got some stuff wrong. We had a pretty good playbook in terms of what to do with the population from the standpoint of reduce smoking, smoking. Because you can take your meds for high blood pressure. We had some close but not quite right nutrition information about that. But generally, the idea was good as far as it. But we had kind of a road to follow. Later on, after everything that we got on campus, we were charged with, can we prevent mental illness? Can we do anything for prevention? Can we prevent the coming on of mental illness? What do we do? Public health science. Because we know about treatment. One thing we did find is a lot of the literature is supported is social isolation. So what are the best practices for building connections and reducing social isolation? What can we do? Tackle that one.
Well, so primary prevention for mental illnesses is difficult because genetics plays a role, environment plays a role, all of that does. And isolation also is related to substance use disorder as well. And so when we think about that, we have to think about, you know, what is a child's experience in school as well. So when you have kids who are kind of, you know, just being different, and then maybe they're in different friends, right? That can become a lifelong journey, which isn't helpful. And so I think the more that we really help children understand and be frankly kind to other people, you know, not do that kind of bullying and isolation, I think it's really important. And also helping kids find each other. You know, sometimes we've seen in some of the schools, depending on the size, it's kind of like, oh, they're the theater geeks, right? But that's okay, and they have their own group. You know, oh, these are the athletes, and they have their own group. And it's just making sure that kids have a group to belong to, and not, again, get really isolated. And I think sometimes we see in the smaller schools that it's harder to find someone who is kind of like you, right? So it's tough, honestly. But I think there are some steps in the schools, and we've seen groups develop in high schools that are promoting actually good mental health and kindness, and you know, having those kinds of programs really duplicated across our schools, I think.
one, strategy, in schools, so often, recess is a very, very low priority. We know it's important to move our body, we're built to move, and yet we sit and sit, need to move, we all need to move. And there's, you know, playful ways to do that too, to make connections and build that social emotional, literacy. Young people have told us too, just in focus groups that we held, that they don't have enough practice in talking to one another. That they've gotten so used to communicating through messaging, yes, this. And they're hungry for it. And so again, I think it is to better understand what our kids are experiencing, what has digital media displaced? And what might we do to enhance young people's experiences and make those I guess youth development, what we know to be true about healthy child development, time in nature, moving our bodies, being together in interpersonal skill development, that there's some pretty basic things we know to be true and know to be important. And how do we encourage bringing those back? Both, and not just in schools, but after school programming and community-based, you know, centers.
Something, because it isn't really just about isolation. So, you know, things happen, right? Traumatic experiences happen, even when parents try to avoid it, right? You can't, it's not your fault if there's a car accident. That's your fault if someone, you know, is killed in your neighborhood. None of that is. And so we also need to help kids be resilient. We want to get rid of those things that cause trauma, poverty and racism and things like that. But we also need to teach them to be resilient. And so, you know, we've seen teaching, you know, meditation and mindfulness and breathing in little kids, right? So that when they start to get stressed out, they know how to calm their bodies down. Those kinds of things are also really important. And even if you go on because of genetics and develop a mental illness, those are still healthy practices to really help you be well with your mental illness. So I think that we have to think beyond just the isolation.
Let's see. So I wanted to get to, are there policy needs that should be addressed in delivering healthcare services through schools? Do we have policy needs there that, you know, I mean, we always look in public health as one of our strategies as policy, but do we have those? Or needs that we
Yes. The Department of Education and Health partnered with the American Academy of Pediatrics and completed our state assessment. It's called HAS, Health Assessment. I'm not going to pick up the thing, but it's a health assessment tool to look at your state and to see what you have in practice and work and policies and things like that, right? And, you know, I mean, one of the things that we don't have is we don't have state standards for health education. We don't have that in Minnesota. That's one of the things that we're lacking. I think states that would be, and not that we need another board, but probably needs coordinated effort around school health in general. Because what ends up happening is like the disease of the day comes and rears its ugly head, and oh, we take care of that. So we're always kind of been in, at least in Denise Herrmann years in school health, a much more reactive approach to school health versus a proactive approach and saying, okay, here's where we are, where would we like to be with it? Again, back to my analogy of the circles, right? Where would we like to be in terms of connecting health and education and moving forward? And not that we need, but one of the things in stats is that there is a central or an advisory group that, so we want to bring forward this legislation or this policy, this practice. How is that going to interweave, and where would be the disconnects in terms of school health, whether it's school-based clinics, school mental health, physical health, you know, we've got SHIP, we've got a lot of initiatives, but there isn't an overall really grand scheme. Back to your point about building mental health system, you know, again, it's very proactive. So yeah, we really could use some policy efforts that would take that step back and say, where does Minnesota want to be? And you know, one of the things is we want everybody to have a medical home. Again, this is Denise Herrmann speaking, not necessarily MPH, but medical home doesn't resonate with everybody. No, it doesn't resonate. So if we really want to improve health for folks, public health meets them where they're at, which is at school. So skip that health and education there because that's where they're gonna go, or they're gonna go to urgent care, right? When all the urgent cares came out, that saw that we, this notion of always thinking that everybody will primary care home. I'm all for it, but not everybody's gonna use it. So how can we still get services to those that don't buy it for that?
So what about other countries for all of our areas? What can we learn from other countries around mental health management?
Honestly, not much. I mean, you can look right now in the UK, kids are waiting a year to get into treatment. I mean, COVID did have a huge impact in terms of, you know, increasing prevalence. But most countries are really struggling with this issue. France, some countries have done a little better for first episode psychosis programs. Some have done, you know, a little better in terms of teaching good mental health practices in terms of, you know, meditation, mindfulness. But it's not, there isn't another state I would go to, and there isn't another country I would go to. Everyone is still frankly struggling to build their mental health systems.
To speak to the issue of digital media, there are a few shining stars out there. Australia, I believe that country, they allow no cell phones in the classroom. And so that's one policy that's really important to protect child learning and mental health during the school day. And the UK, this online harms prevention work group I just mentioned, there's, I didn't mention that over half the members are individuals, parents who've lost their sons and daughters who have died either by suicide because of extreme cyberbullying or through these online challenges on YouTube, these choking challenges. Several parents have lost their children, and others because their children were able to access drugs laced with fentanyl through social media apps. Literally, the drugs were delivered to their house like a pizza in the middle of the night. So, one parent in particular from the UK, his daughter Molly died 4 years ago because of extreme cyberbullying, and he took it upon himself to really get activated and push for legislation. And legislation just passed this fall that will make the tech companies design their products so that they are safe for children, and when they are not, they will be fined. So the UK right now is leading the way. I think, again, school health nationally, it always, lots will depend on your, like, if you have a universal healthcare system like the UK, or you have no healthcare systems, but some of the same struggles exist no matter where you're at right now.
Do you have any tips for teachers, coaches, trusted adults, teens to recognize signs of stress among peers?
Well, we were the first state in the country to actually require teachers to have continuing education on early warning signs of mental illness in youth. So all teachers have to have that as part of their continuing education. We actually deliver the class for teachers, and we have found it actually to be really helpful. That instead of seeing behaviors in the class, they're seeing symptoms in the class, and you know, sort of punishing a child, figuring out what they need to be able to calm themselves down. So I think we're already doing that, and we have seen, you know, not that it's 100% perfect, but we have really seen the turnaround in our schools with a greater understanding of some of these early symptoms.
I think then that, I totally agree with everything that Sue said, and I think it has to be something that is always top of mind. That we really can't let our foot on the gas, so to speak, with that, because kids are so concerned about their peer group, right? And so they making it, you know, that the care for my friend who is saying, I don't know what I can live for anymore, and not thinking I've got to hold that all to myself, but sharing that and bringing that to a trusted adult. We can't let go of saying that we have to do that over and over and over, because that message will never be done. In terms of doing that, because it's the nature of adolescents and children, right? To hold that, to protect that friendship and think that I can take care of that. So I think that's the other thing, we've done a great job, but we can't take care of that. I've got one thing, and that is last session, a law passed that required all student IDs and things that get handed out to them to have 988 and the county crisis team on the back, so that they, you know, some of them don't actually know what that means, but it's a first step to know that that's actually a number that you can call.
So, my offspring, one of them has reproduced. So the offspring have some young offspring that come to our house every day. Well, and they came in the other day or just after Christmas. That Grandpa Santa gave us iPads for Christmas. Age 3, but I know body's going, oh, but I wonder, are there recommendations about ages for like self, that kind of thing for parents? Is that out there at all? So nuts.
Yeah, there's, the American Academy of Pediatrics has some great resources, for families, in making that decision. And they're family media plans. So if it's already been a gift that's been given and you can't prevent that from happening, there's a great tool on the American Academy of Pediatrics that is called healthychildren.org, where you can create a digital family media plan that sets the boundaries of the rules for how digital media will be used in the house, and it can be tailored and enter information, and it will produce you know, a document that family members can sign and agree upon. So I think, yeah, it's just to really consider that the lure, to understand that the lure of technology is so great, and as children, their brains are still developing, so it's to fill their day with other things, to do those activities outside and interpersonal, like all those things we know to be good about healthy child development as a means for prevention and dosage, right? To be cognizant. I think the recommendation is after an hour a day for that age. So there's also a big movement, I would just mention it now, called Wait Until 8 for smartphones. And it's really important that a community of parents are all in on that, because you don't want to be the one child who doesn't have a smartphone. That is actually pretty stressful experience. So there's just other phones that you can get now, smartphones. I'm just blanking on the names. There's a couple that are available until after 8th grade, when the brains are not fully developed, but still regulation is really hard because of the way that these products are designed. So, we go on and on about this, but yes, there's guidelines.
I know what to do. We've got just 5 minutes left. And so usually it's like closing comments, you know what, but this is your stop. You know, these public health influencers, experts, so any last words for this group in terms of a charge coming forward for our public health folks, and even, you know, the public health association. So it's all yours for a couple minutes. We need you for you.
Well, I guess, just actually help advocate for building our mental health system. Because primary prevention is important, but we also need to make sure that when kids need treatment and services, that they get it. We have kids boarding in the emergency room, we have, sometimes we have kids who are sent home actually on a tranquilizer so they get home safe. We've had situations where parents whose kids were boarding in the ER were actually referred to child protection when they weren't neglecting their child. The system was and so we really have a lot of, frankly, bad fallout from the lack of services. So we need everyone, frankly, to advocate for children, both for primary prevention, but also access to
I think digital well-being is something that starts with us. And just as a parent myself, my sons are now 24 and 20, but really being mindful of my own use around them. And sometimes I'll say, Mom, Dad's on the phone, or you're on your phone more than I am. And so it is to really just become aware yourself. There's some really great books. One's called Stolen Focus. Has anyone read Stolen Focus by Maree? Fabulous book, a journalist out of the UK who took 3 months and went phone free. His experience, he traveled around the world, he interviewed all these researchers. But just to become informed, I think, is really great. There's another one called How to Break Up with Your Phone. So if you feel you want to break up, that's a really great resource as well. So I think just being informed yourself and then bringing it into the work setting, bring it into your public health setting and making it part of the conversation. So if we're talking about mental health promotion, we want to promote the well-being, particularly of children and young people. This issue has to be a part of it because it is such a huge part. Average teen is using digital media 7 hours a day. That's beyond what they're using their tablets for. So that's entertainment. So we're a country that has a lot of young people and children using technology for entertainment. And so it is just being aware of that and supporting other opportunities for young people to be out and about and engaging with one another. So whatever that looks like in your community, supporting those community-based after-school programs, your nature centers, your all the opportunities that young people and children can have so that they are not as consumed with the media.
Well, I think it's natural. I think the organization supports public health, they support school health, state, national things. But back to my first comment, schools are local control. So my challenge for all of you is to go back to your local public health school district. You vote for school board members who direct policy and programs in your local school district. And what are they doing? How do they take care of health? How do they promote health? Who's on staff? Where are the dollars going? Is the dollars going for a new turf for the football field? Or is it for staff? And they have to make some of those difficult choices. And we saw during COVID that the minority loud voice are often the ones that are showing up to make local decisions. And so I am empowering you and challenging all of you to make and get your group to be the loud voice in local decision making and specifically in schools and on school boards so that health and education are a priority for the children in that district.
I want to add one more thing. We do have some leaders in our state that are really advocating for digital well-being. So Pete Ellison is our Attorney General. He's part of that suit. So reach out and thank him. I'm sure these legislators don't get thank yous. We also have the opportunity to put pressure on our senators. Our senators are very supportive of this as well. So thanking them for their support of the Kids Online Safety Act. There's a hearing at the end of January. So don't hesitate to reach out to our Minnesota legislators to thank them for the work that they're doing to try to put some reins on big tech.
I would like to thank our panelists for being here today and for being so insightful. Thank you. Again, how important it is that now work with public health. The point is the spec of time. But even what happens right now with us, one of the best things about working with public health, you have to get up every day and feel like I'm for work. Try to make it better. So just want to thank you for your time today as well. And I know that you over San Antonio here, but take good care of yourself.
Thanks, everyone. This room looks beautiful because you're all here. Thank you for coming. Thank you, our panel. I learned so much from you, and it was wonderful to get a refresher on things that we as adults need to be reminded of. I have 2 gift certificates to Starbucks. We invited you to get a cup of coffee on us. And my first question is, who has birthday closer to this month? And this day, today is the 16th, 19th of January.
I'm September, so someone's got to be closer than September.
Yes,
You?
January 10th.
Oh.
You're hiding back here like you don't want coffee.
We trust you. And the next one, we are in New Brighton. Who drove the furthest from New Brighton?
Yeah. I was like, Starbucks has to go, so that might be good for your drive.
Thank you. Thanks for coming.
Yeah.
All right. Thank you, Angie and her crew, for preparing that wonderful table for us. They don't want to take the food home. So stop by, there are plates and there are cups, and bring something home for the road, especially those who have a long drive. Thanks again for your participation. Thank you for your engagement and the questions. The conversation was very, very interesting and helpful for all of us. So just reminders again about saving the date. March 22nd and May 17th are our next 2 sessions. One, we're going to talk about the mid-years, and the other one, we're going to talk about the older generations. And then our annual conference, thank you, Dave, for reminding us, it's going to be April 25th and April 26th at St. Kate's. And our proposals are accepted until January 26th. Thank you so much. Thanks for coming. Bye.
Want to go say hi to Denise?